So, as I said before, rhinoplasty is generally divided into two big groups. There are closed rhinoplasties, where maneuvers are performed through small incisions in your nose, and then there are open rhinoplasties where basically the bottom half of your nose is opened up and the entire structure is peeled back, and that allows us to get inside and look directly at the anatomy of the nose and see what the anomalies are and fix those, and also perform more invasive maneuvers. Many of the rhinoplasties that I perform, for instance, are open because the patients require some tip work, which you need to be able to see a lot of the tip that you're doing. I also tend to do very comprehensive rhinoplasties in terms of I like to go all the way back to the back of the structures of the nose, correct all of those, and then work my way forward again from the back. And a lot of that is done through an open rhinoplasty. And the reason I mention that is because due to the fact that it is an open rhinoplasty, you generally get swelling afterwards, and that swelling is substantial. You wake up after the operation, you'll have swelling over your nose area. Sometimes you'll have some bruising, and depending on whether some bony work has been done to your nose, you'll have some bruising that'll track down the side of your eyes, so you may wake up with black eyes. But this is something that would have been discussed with you beforehand. Generally speaking, you have a splint in situ, so it's either a little plastic version that floats on the dorsum of your nose and basically runs from the top just to the tip of your nose. That's one type of splint, and some people choose to use a more extensive splint, which goes from your forehead down the middle of your nose and towards the tip, and that also depends on what kind of work you've had done. Once the splint has been taken off at 1 week, you'll still have a lot of residual swelling, you'll have some bruising, and that bruising generally subsides at about 2 weeks. You'll get some color changes, some green and some yellow, and then generally it'll settle down. At that point, you'll probably want to see your surgeon, and he'll check that everything is healed. So you'll have the sutures removed from the bottom part of your nose, and at that point you'll have some idea of the work that's been done. Swelling, however, is considerable with open rhinoplasty, and we normally say that going out in public, you're probably going to be able to do so at about 2 weeks. You're going to notice that there's swelling there for up to 6 weeks, and from a plastic surgery point of view, we'll know that there's still swelling there for 3 months, and in some cases up to even 6 months. So a realistic expectation after rhinoplasty is, from a social point of view, 2 weeks. From a plastic surgery swelling point of view, 6 weeks to 3 months, and then your final result will probably be about 6 months. So that's important also to consider in the context of your social environment and what you've got planned, and those all need to be discussed before you have your procedure.